COVID-19 cases are surging in Maharashtra once again. There have been over 3,300 cases in the last 24 hours. This number was over 4,000 the day before. Now, this is worrying for the state of Maharashtra, but what's even more worrying is that only 71 out of 1,926 people showed up for the second dose of the COVID-19 vaccine yesterday. I repeat these numbers. 1 month ago, there were 1,926 people who got the first shot of the COVID-19 vaccine. They were scheduled to get the second shot yesterday, but only 71 people showed up. What does this mean and what happens if there is a delay? We have Dr. Gautam Bhansali, the Chief Coordinator of Private Hospitals in Mumbai, also a consultant physician with the Bombay Hospital, joining us. Thanks so much. Dr. Bhansali, what do you make of these numbers? Only 71 of 1,926 people show up for the second dose.
Yes, that is true that yesterday there was only 71 people was vaccinated second dose. And there are three major reasons behind this. One was there was a big technical glitch on this COVID app. So many people who received COVID vaccine on the 16th of January, day one, their name was not reflected on this COVID app. So that was the major reason. So many healthcare worker was returned back. They were sent back because their name was not reflected on this at this app. So this was the basic technical glitch was there that was causing the problem. Their name was not reflected. That's why they were refused. In fact, the first person who took this vaccine, Dr. Mrudula Patil, her name was also not reflected in this app. So that was the major issue. Second thing was that there was a lot of misinformation in the WhatsApp University and Google that regarding the timing of this second dose. Some says that you should take after 28 days. Some messages were saying that you take after 8 weeks. Some messages were saying you take after 12 weeks. Right. So that was also misinformation regarding this timing of the vaccination. And third issue was that 2 days back only in Mumbai, they allow private hospital to give vaccine to their own staff. So many doctors were reluctant to go to other sector. They were thinking that in next 2 or 3 days, the vaccine will start in their own hospital, all hospital setup. So why to go to other sectors? So that was also one reason. All the private hospital, around 25 to 30 private hospitals, they are allowed to give vaccine to their own employee. So that's why number was less.
The question,
but the major issue was
the question that I have, and I have two questions. One is that do you fathom that this would have led to a big wastage of vaccines?
This is not wastage of vaccine. I feel if you take vaccine after 2 or 3 days, that is not going to harm or that is not going to wastage of the vaccine, because they all have the storage capacity and they can maintain the temperature and that their efficacy. So wastage is not there.
Okay. So wastage is not there. But what about the delay? If there is a delay in taking the vaccine dose, what's the time? What's the time frame, so to speak? Because 1 month is what India is following. But how much can you delay it?
So we can delay as per the new guideline, as per new data. They are showing that if you should take second dose from 4 weeks to 12 weeks. So anytime between 4 weeks to 12 weeks, again, because of some misinformation that you should take only after 8 weeks, that because of that turnover was also low. But that is not going to harm, or that is not going to wastage the vaccine, or that is not going to wastage the first dose also. It's not like that at all. But I feel sooner is better. If we finish second dose as soon as possible, then we can give to the other people.
Which brings me to my final question. Doctor, if you could just highlight for our viewers, how important is it to complete the 2-dose regimen?
I feel for the efficacy of this vaccine, you should take second dose, because I have done myself that antibody after taking first dose, after 4th week of the first dose, I have checked my antibody. It was 32%. If I take second dose, I have taken second dose yesterday only, day one. And I'm sure that my antibody will go up to around 100 or 150. So to increase your antibody level, you have to complete your second dose. Second dose is very, very, very important for the efficacy, for the potency of this vaccine. But You have to decide what you want. You want vaccine or you want that virus.
All right. So you have to choose between the vaccine and the virus, and I think that's a no-brainer. Thanks so much, Dr. Bansali, for joining us with your point of view on that very important story. We'll keep a close watch on what's happening in Maharashtra.